Dietitian here with Dr. Hashmi, nephrologist. Thanks, Dr. Hashmi, for being here and taking time out to answer lots of questions.
Yeah, thanks, guys. Thanks so much for joining.
Yeah, we have 30 minutes. So we have some questions submitted ahead of time and then some that are already coming in. So we want to get to as many as we can. Dr. Hashmi, one that was submitted ahead of time,
Mhm.
um, they're asking about, and I don't know if you saw my email. I was trying to send it to you, but I will probably say this wrong. But they had a CT scan to look at a history of kidney stones, and they found cholestasis of the
Mhm.
kidneys, and they're wondering what that is and can that impact kidney disease.
So it's not so much that it's going to impact kidney disease. It's basically you have these calluses, and the calluses are dilated, and that can happen after inflammation, after infection, and usually it's not anything that per se is going to be an issue long term, unless the underlying condition is not taken care of. So that's where it's all. It's just a term that you see on imaging, is what it's called, and it's basically there's dilation, and then eventually it can lead to scarring.
Got it. Okay. Okay, so someone asked, they're wondering if we could offer any comments on Rude Health coconut drink. It has rice and calcium. Um, so I was looking at that ahead of time. So I just looked it up and it looked like the ingredients, basically it's water, rice, coconut milk with some sea salt. When I look at the nutrition information, I think the main thing is it looks like it doesn't provide potassium content. So sometimes coconut milk or coconut water can be high in potassium. So again, depending on your needs, that would be one thing I'd be curious to know. And then the other thing is the amount of sodium that's in it because that's added in. So that could be a little high. Again, it would depend how much of it you're drinking. So I can't say yes or no. The ingredients aren't necessarily bad, but you would really want to know how much potassium's in it because a lot of times those coconut milks or coconut waters can add up to be a lot. Okay, how bad is levofloxacin for kidney infection?
Yeah, and by the way, this first question of root, I had never heard of that. So now I'm all curious. So I'm actually on the website looking at it right now. All right. So in terms of levofloxacin is a class of antibiotics. It's part of the fluoroquinolone family. And are there cases of acute kidney injury that's reported with taking it? Yes. Are they rare? The answer is yes. So in other words, both things can happen, and it's not something that happens very often. More commonly, what you have a higher risk for is things like C. diff colitis, which is basically if you get on an antibiotic for a prolonged amount of time, it can kill the bacteria in your gut, and that can lead to a very nasty infection that can occur. And the treatment for that ends up being more antibiotics. So, yes, so it can happen, but acute kidney injury can happen with just about any antibiotic dose, and it's a little bit more on the rare side.
Okay, thank you. Next question from Casey. They said if you're younger in stage 3 to 5 kidney disease, should you be on a low protein diet? And then if you're younger but on dialysis, you need a higher protein diet. Um, and I mean, I'll briefly say something, and then Dr. Hashmi, I know you just did a whole live where you talked about this and some new research. In general, for stage 3 to 5, lower protein is recommended, and then higher protein when people are on dialysis. And then there is some more research on people over 60, over 75, if you want to touch on that, Dr. Hashmi.
Yeah, so remember, when you're on dialysis by its very definition is a very highly inflammatory condition. It is a catabolic condition, which means you're breaking down muscle all the time. So the whole reason for recommending higher amounts of protein is the fact that we're hoping that that will help in terms of supporting your lean body mass. Number two is when you're on dialysis, we are not worried as much about things like uremic toxins or the acidity of protein causing kidney function to decline because of the fact at this point in time there's very little kidney function left. Number two, we're dialyzing, so we're removing the uremic toxins out of you. And then what Michelle was alluding to was the idea of this concept of mortality or risk of death. So, what the data shows, this isn't new data, but it's existed in other fields, is when we looked at dialysis patients, when we looked at patients who were elderly, patients who had cancer, God forbid, when they lost weight, their overall risk of death always went higher. This is known as the obesity paradox. So, this latest study that we reviewed was the one that talked about the fact that if you had significant kidney disease, and you were elderly, reducing protein intake may not be the best option simply because of the fact that as you're losing that lean body mass, your risk of death goes higher. So, in other words, could there still be impact to the kidneys? Yes. But when you look at the grand scheme of things, you can live without your kidneys, but death is permanent. So therefore, when we look at the grand scheme of things, what we talk about is as you're a little bit older, and in this case, it was specifically over the age of 50. So it's not, I mean, I'm 49, so it's not like, I hate to say the word old, but yeah, you start to think about those things, and you want to keep in mind that, yes, especially if you're somebody like stage one, two, three, you want to, and you are older, you want to get higher amounts of protein. And that's still going to be the case. Now, in that study, they did not show a difference between animal versus plant proteins. They showed that both of them had good benefits overall. And part of that rationale behind there was they were focused on lean body mass. We're still focused on not just lean body mass, but your overall health. And that's why we look more towards less acidic foods, in other words, more alkaline type foods, and that's just eating more plant based foods. The more you go towards the spectrum, and once again, you don't have to be 100%, but as you shift to more whole food, plant based ideology, you will find that your overall health, your mental clarity, your quality of sleep, your relationships with your partner, all of those things are going to move in the right direction because of all the benefits we see in so many different parts. So when you look at a study, you want to look at the study and be focused on what it's trying to show, and then look at the bigger context. So don't just say, this study says the world is flat and therefore all the other studies are wrong. This is just one small study looking at the ground in front of you and it looks flat. They're not wrong, but you have to look at it in the bigger context.
And that study excluded people with stage 4 and 5 kidney disease that were not on dialysis. So
Correct.
very late stage where we typically use, we're a little more restricted with protein to slow that progression even more. It would be interesting to see if they had, obviously included those stages in the study.
And we're going to have data on that because remember, those are the patients who are going to have the most rapid muscle mass loss because they're older and they're starting to get those uremic toxins. And so then comes the question of what becomes the priority? Is it protein? Is it lean body mass? Overall, is it the fact that it's progression to dialysis? And this is why no matter who you are, male or female, but I will emphasize females more than male, you have to do strength training. You have to do strength training and you got to lift weights at least 3 times a week to get some real benefit out of it.
Yeah. Okay, next question is, two parts, can someone with kidney disease stage 2 have egg whites, and can they have milk? So two things, I would say about that is definitely it's possible to fit that in your diet if you want to. With milk, I would be very careful about the phosphorus and the potassium. It is higher in, just regular cow's milk will be higher in both of those, especially phosphorus is more absorbable coming from an animal source. But and with egg whites, it's really about what you're pairing it with and what the rest of your diet looks like. If someone's consuming eggs and they eat it with bacon and toast and butter and cheese, that is way different than if they have eggs and they have it with veggies and toast and a little bit of avocado, and they're getting lots of fiber, and those alkaline foods like vegetables and fruit are offsetting, some of that more acid forming foods like the animal protein. So
And this is exactly the point of most population based studies on eggs. The problem is it was very hard for them to control what else they were eating. And that's why studies have gone back and forth. Eggs are good for you. Next year they're bad for you. Next year they're good for you. And the reason for it is what else are they doing? What else are they eating? And that's why what you'll find is studies on eggs that were done in the United States showed eggs were bad for you. Studies that were done in Europe on eggs showed that eggs were good for you. And so that has to do with our eating lifestyles are so different, and that makes a bigger impact. With milk, just remember, with cow's milk, I have yet to find any redeeming qualities that are there. Now, we're not talking about things like Greek yogurt or cottage cheese, etc., but specifically about cow's milk. That one is very hard to find anything redeeming. And that's why things like almond milk, soy milk, all those things, oat milk, as long as you keep the sugar out of it, meaning unsweetened, because now the thing is, when you get these plant-based milks that are quote unquote vanilla flavor and you look at how much sugar it is, you kind of defeat the whole purpose. So in our house, we shop at Costco. I think Costco is national. We don't get paid by Costco, but I absolutely love Costco. And now all the stuff they have for plant-based milks, they have it unflavored, which is awesome.
Yeah, plain, unsweetened, and check the ingredient list to make sure there's no phosphorus additives in the plant milks. Okay, what can someone with polycystic kidney disease do to slow cyst growth?
Yeah, I think we have a couple of episodes now on this, and you can hear all about it and read all about it. But essentially, there's two things that have been shown to help. So the first one was, of course, if you eat more of once again, a whole food plant-based type diet, you're going to lower overall inflammation. If you're drinking a ton of water, both of those things are going to help reduce the rate of growth. The other thing was there was some very interesting data on getting rid of sugar completely. So a ketogenic type of diet, and we favored more of a plant predominant ketogenic type diet. And that was also shown to reduce the risk of cyst growth. And don't forget, there's actually medications now. There's tolvaptan that has been studied. So you can use tolvaptan, but you have to make sure that you can drink enough water to stay hydrated while you're on the drug.
Yeah. All right. Dr. Hashmi, do you know anything about NAD drops for people using them in CKD? I believe there's some research on that, but honestly, I don't even want to comment on it unless I
There,
looked into
there,
it
un-
more.
unfortunately, there isn't any convincing data that I've come across so far that would say that it would alter the outcome. In fact, we've been looking for stuff, and there's a lot of stuff that there was a small study that showed a slight improvement by taking X, Y, and Z. The problem with those studies is there are so many flaws in them that they give people a false sense of hope. So in the end, the biggest thing that's going to make an impact on your chronic kidney disease is your weight, is your blood pressure, and it's your blood sugars. Those are the three biggest variables that you get to control, and you can control them by adequate sleep, by moving and making sure you're lifting along with cardio, by getting rid of stress out of your life, having consistent regimens and doing that, and by eating a predominant plant-based diet. That's literally 99.9% of what the data has consistently shown. With supplements, we've never been able to come up with a determination around that. And so just be careful in spending your hard earned money. Michelle and I, we don't have any supplement sponsors. We're not here trying to peddle anything to you guys. We tell you the data. You can look at the data and then you can decide if it makes sense for you or not.
Yeah. Okay, next question. Can eating non GMO organic soy help people with kidney disease? Yeah, so definitely, I mean, soy protein, minimally processed, organic, so things like tempeh and tofu and edamame are all great options as a plant protein source for kidney disease, especially, assuming you're swapping the animal protein for that soy protein and then pairing it with fruits and veggies and these other great plant foods. But there's a lot of research on the plant proteins and soy with kidney disease. All right. I want to donate my kidney. What should my creatinine level be and able to donate?
So, in other words, I mean, we want your creatinine to be normal range, right? We're looking for people who don't have kidney disease, who have healthy blood pressure, who have healthy weight, and are not diabetic. Now, if you are those things, we want to make sure that we work with you to improve all of those things. The biggest reason that we make such a big deal in kidney donation is the last thing we want to happen is you donate a kidney and now you end up on dialysis. You did this remarkable selfless thing and essentially you got this adverse outcome. So that's the worst part about it. And so this is why we're so strict on evaluating the donor to make sure they are healthy. And we don't see any risk factors moving forward that could potentially put them in risk.
Yeah. Dr. Hashmi, do you know of any over the counter continuous glucose monitors that people can get?
Not OTC. So I know a bunch of companies where you can go online, they have a medical provider that will do an evaluation online through a video visit and so forth. They'll check some blood tests and they can go ahead and make that prescription for you. But to the best of my ability, and I haven't looked at Amazon lately, and while we're talking, I'll pull up Amazon, but I am not aware of a single place offering a continuous glucose monitor. Now, keep in mind, continuous glucose monitors can be very helpful in being able to see how you respond to certain foods. So, if done properly, they can improve your quality of life a lot. I know a number of elite athletes that use continuous glucose monitors in terms of helping with their optimal nutrition prior to intense workouts, post workouts, maximizing their recovery. And so, yes, they are being used, especially in the elite sports world, to be able to time nutrition, seeing the responses, making sure that people are getting adequate sugar levels going into intense workouts
Yeah.
and not blowing it too high or too low.
Yeah, I think there are, and again, I don't know what brands off the top of my head, but again, there are, like you said, some websites where you can talk with a doctor through there and order one. And again, it's usually outside. If someone doesn't have diabetes, then often it's, you're paying out of pocket outside of, your insurance covering it. So I know there are options with that, but I don't know any specific brands. Um, are omega 3s helpful in IgA nephropathy?
There was a time where we were still talking about omega 3s, but I can tell you just about every nephrologist will say the same thing now, which is they're really not part of the treatment modality. When it comes to IgA, back in the day, there was some data that looked at really high doses, like 10 grams or so. Nowadays, not so much.
All right. Oh, this is a good question. Do all CKD stage 3A patients progress to end stage renal failure and dialysis?
Yeah, absolutely not. In fact, we have a number of patients who are CKD3, and it's not the stage you're on, it's the rate of decline that matters. I have patients who are CKD5, and they've been that way for 10 years. They haven't progressed. And so, therefore, the question becomes is, well, what you tell the patient, you say, look, you're doing a great job, you're awesome, and just keep doing it. And God forbid if things were to change, we'll cross that bridge. But if we make you worried about it, it's not going to solve anybody's problem. So the rate of decline is the most important part that's going to determine if you're going to go. If you've been CKD3 year over year, you're not seeing any changes happening, don't worry about it. Stay healthy. Do the stuff that we've talked about 1,000 times to do, and that's all you need to focus on.
Yeah, exactly. I mean, my grandpa had stage 3 kidney disease for 10 to 15 years and he died at 92. Not from anything kidney related. So, okay. Oxygen infused drips. Can that help stage 3?
Unfortunately, no. No, we wish that, something as simple as that would do it, but the answer is no. We don't have any evidence so far. And what I would say also is if you guys who come on the show and listen, if you find an interesting study, send it to Michelle and I. We'll take a look at it, we'll review it, and we'll come back on the next episode and bring it to you guys.
Yeah, definitely. How reliable are urine dipstick tests? If the results are negative, does this mean that the protein levels are normal even if the UCR test shows 200 milligrams of protein?
Well, there's different types of proteins, right? So a dipstick will not pick up things like light chain proteins. So if you see a urine albumin test that's basically showing protein, then we need to investigate that further. And so remember, a urine dipstick is not the most accurate test, it's not the most comprehensive or complete test.
Yeah. Okay. Let's see. How will CMOS help or harm kidney stage 4? I mean, I'd say again, always with it, the main thing is like I guess the form that you're consuming it and how much, because potassium and iodine levels could be very, very high in sea moss or sea vegetables. And in someone with kidney disease stage 4, that may or may not be a problem. I don't know. Do you know any specific research on like helping with that?
No, no, I haven't come across any. And once again, if you guys have, shared with us. We would love to know, but I can tell you I have not.
Yeah. Okay. Are keto steroid good for CKD patients as a protein substitute? Um, so keto sterols, like the keto analogues, it's not one, I haven't worked with people using that because it's not one that's used in the United States. But it's a, keto acid, keto analog. So usually in later stages, like 4 or 5, if someone's following a very low protein diet, then you do have to supplement with a keto analog. So it's a specific amino acid supplement that doesn't have the nitrogen that's used to supplement a very low protein diet. So definitely that needs to be done under supervision of, your nephrologist and renal dietitian, because you have to make sure that you don't have deficiencies in that diet. But definitely it's something that can and is used. It's just not across the board like everyone with kidney disease would use it. Okay. Yeah, and same, I guess we can dive into, there's a question about taking amino acids in the form of supplements if you have kidney disease. I feel like we did a
Yeah,
topic about it.
remember, with amino acids, the reason people are doing that is because if they're on a low protein diet, they don't want to have a deficiency, especially of the essential amino acids. That's why people end up, and especially if the dietitian or the physician prescribes a certain amino acid regimen, it's only because of the fact that they're on such a low protein diet that we're literally worried you will have a deficiency around. That's it. That's literally it. But beyond that, no, there isn't anything more to it.
Yeah. All right. This person says their blood sugar drops all the time, no matter what they eat. What can they do? They have diabetes and they have kidney disease, stage 3B.
So remember, when you have essentially episodes of hypoglycemia a lot, the first thing to understand is when you have kidney disease, the insulin that you secrete hangs around longer. So let's say you do eat, you may not need the same amount of insulin that you're already on because your kidneys have gotten worse. In fact, the telltale sign of kidneys getting worse is that diabetes looks better. And what we tell our patients, the patient will come back and say, "Oh, look, my A1C is better." And the answer is it's not that your A1C got better, it's that because your kidneys got worse, the amount of insulin hanging around your body is causing your blood sugars to go lower. That's not necessarily a good thing. And so when you have kidney disease that's advancing, you will find that if you are not eating at the same time every day, if the amount of food you're doing is fluctuating between meals, all of those things are going to affect blood sugars. And the last thing we want to see is a very large spike followed by a low. So, what we tell our patients is, especially when they suffer from highs and lows, it's to eat smaller quantities more often rather than eating bigger meals. When it comes to weight loss, that's the opposite recommendation we give, in that we ask people to eat 2 to 3 meals per day and to stop eating 4 hours before bedtime and all those kind of things because of the fact that we're trying to reduce all of those overall cravings and the reactive hypoglycemias that will occur. But in diabetics who are already suffering, small meals more often, and trying not to have it so that the glycemic load is very different from one meal to the next. You're trying to get rhythms. And if you get rhythms, you find that your blood sugars will be much better controlled than if you're sporadically eating. And oftentimes, what happens is when people's sugars are low, they overdo it to correct it. They overdo it with drinking whatever it is. They're drinking juices or so forth. So now the blood sugar shoots up very high. As a result, your body will release more insulin and it will overshoot because you have insulin resistance. So, what happens 2 hours later? First, your sugars went up. 2 hours later, now the sugars are too low. It's because of the fact that you have this insulin resistance.
Okay, are there any specific grains that are not good for kidney health? No, their grains have different phosphorus, potassium, and protein levels. So it really just comes down to what your needs are. Quinoa is one of those examples. That's a great higher fiber, higher protein grain, but it's also higher in potassium, where, wild rice and millet and farro and barley and bulgur, like there's tons that are lower potassium grain. So there's no like grain that's, hey, this is bad for you to eat. It would just depend on what your needs are. Okay, I've read that almond milk is heavy with oxalates. Okay, so almond milk compared to other plant milks will have more oxalates because almonds are higher in oxalates. We have multiple videos on oxalates because for majority of people, it's oxalates and consuming oxalates are not the problem. And when it comes to plant milks, typically, depending on which brand you're buying or you're making it yourself, the amount of almonds compared to how much water is used, it's a lot different than if you were eating almonds. You're getting way less potassium and oxalates and these other nutrients because almond milk has so much water in it. But I would definitely check out our videos on oxalates because there's tons and tons of myths and misconceptions around oxalates and kidney health. Okay, I started to look for a protein supplement after watching a video on higher protein intake for older people with CKD. I found some, but the phosphorus is not included on the nutrition label. Any recommendations? I would say it comes down to what type of protein supplement you're looking for. We always advocate for getting it, if you can get it in your diet, that's always going to be best because it's going to come with other benefits, fiber and vitamins and minerals and phytonutrients and all these things that come in these foods. And then as far as a supplement goes, like if you were doing a powder or anything, again, a plant protein supplement that's like soy or pea or hemp hearts or hemp seeds is going to have less absorbable phosphorus than an animal protein supplement. And then you can check the ingredient list and look for phosphorus additives that will be more absorbable. So that's really what I would look at. But if you can get it from food, which most people can, then that's always the best first route to go. Anything, Dr. Hashmi, you want to say on that? Okay. Um, there was a paper about 6 months ago that indicated that NMN might be toxic for seniors, but I don't know what that is. NMN.
Oh, so NMN is another product that's been touted, and especially when it comes to things like the anti-aging community, it gets brought up a lot in that. So there's a few things that are being studied. NMN is being studied, metformin is being studied for anti-aging. So it's been out for a while. But the answer is yes, there was a paper several months ago that I recall. We didn't do any episodes on it, but yeah.
Okay. When will mechanical kidneys be available to the public? I know someone who has one already.
What? Someone has one already? That's news to me. When I was back in med school was when we were first talking about the artificial kidney, and since that time, this was the UCSF project. Technology has gotten so much better. They were able to reduce the size of it. There's so much work that's gone into it, and I know that there's been testing that's been done, but I'm not aware of anybody that's gotten one. So, if you have any information, please share it with us, and I'll see if there's any new news. I'm actually Googling it right now, but I have not heard of anything. The Kidney Project for UCSF, the website is still there. But I don't.
Hopefully, though, right? All right. Protein is high. Nephrologist recommended blood pressure pills, but already have blood pressure problems. What to do? So I assume their protein in their urine is high.
Mhm. Yeah, so remember, when we say it's a blood pressure pill, a lot of medications have multiple things. So, blood pressure medications like ACE inhibitors, yes, they lower blood pressure. They lower the risk of death from things like heart attacks, stroke. We use it for that purpose. We're using it in diabetics because they reduce the risk of mortality. They also protect the kidney by reducing protein in the urine. So, when your nephrologist says this is a blood pressure medication, yes, and it's got all these secondary mechanisms that you want to know about. So definitely talk to your nephrologist. There are all sorts of classes of medications such as ACE inhibitors, ARBs, aldosterone antagonists. There is SGLT2 inhibitors. There's a number of classes, more so than ever before, that are available to you, and we want to look into seeing if we can use those.
Yeah. Okay, last question because we're coming up on our 30 minutes. The nephrologist says sevelamer is the first line option. Is it worth bringing up concerns about elevated calcium levels? So sevelamer being the phosphorus binder. Um,
Exactly. Because it's not a calcium based binder, it's not going to raise your calcium. Oftentimes, we use it in patients where the calcium is high. And overall, sevelamer is a great agent. There's some really good data on it.
yeah. Okay, there's a lot more questions in the chat that we couldn't get to. We will be back here and we'll try to look through afterwards. But save your questions. We will be back next month, third Tuesday of the month at 5 o'clock Pacific Standard Time. You guys have great questions. We appreciate you being here with us, and we wish we could stay on for hours and hours and answer them all. But we will be working on more episodes for you too to answer your questions. So thank you, Dr. Hashmi. We all appreciate it, and we'll see you guys next month.
Thanks, guys. Bye bye now.